We are, of course, assembled on the traditional territory of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. I'm joined by my colleague François Legault, the former chair of COF, to answer any of the questions en français. We will have, of course, a full press conference at the conclusion of our Council of the Federation meeting, but I wanted to get out this morning to talk about the communique which we just released. I'm sure you have it in your phones and inboxes. We have again reiterated our view, our unanimous view, that it's past time for the federal government to stop quibbling, to stop saying that we don't have a problem with our publicly funded national health care system, and sit down at a table with the 13 premiers from provinces and territories and do what Canadians want us to do and get ourselves back on track to have an envious world-class healthcare system, not one that is crumbling under our feet. So I'll ask François to say that en français, and then we'll take some questions.
Oui. Bonjour tout le monde. Écoutez, on va avoir une conférence de presse par la suite pour répondre à l'ensemble des sujets qui ont été discutés. Mais hier, on a encore discuté du financement des soins de santé. On a répété notre demande pour une rencontre avec Justin Trudeau. On a répété qu'actuellement, ce n'est pas possible de continuer à avoir seulement 22% des dépenses qui sont financées par le fédéral pour les dépenses en santé. Les provinces ne peuvent pas continuer à payer 78% des dépenses en santé parce que la croissance est exceptionnelle, 5-6% par année. Donc, c'est un problème unique qui doit être partagé avec le fédéral. On réitère notre demande pour une rencontre, puis pour augmenter la contribution du gouvernement fédéral de 22% à 35%. C'est important pour être capable de continuer d'embaucher des infirmières, d'embaucher du personnel, puis de continuer à donner des meilleurs services à tous les Canadiens. Merci.
Great. As a reminder to everybody in the room, one question, please, and direct your question to the Premier that you would like to speak to. Go ahead, David.
Hi, Premiers. David Cochran with CBC News. I'm wondering on two quick things. If you can give us a sense of how Minister LeBlanc's comments were received in your meeting last night after you left here, after he did the interview. And also, more broadly, if the federal and provincial governments can't even agree on the basic facts of what the split is on healthcare funding, and if Premier Legault, if you won't accept conditions on the transfers you're requesting, how do you find common ground on fixing the structural challenges if you can't agree on the basic facts of what we're dealing with here?
Well, with respect to Minister LeBlanc's comments, I commented on that directly to you yesterday. They're disingenuous to suggest that phoning me at 8 o'clock in the morning on a Sunday after months of inaction and saying we're working together, I'll leave you to draw conclusions on that. But that's really not the point. It doesn't matter when ministers speak to each other. What we've been asking for and what the Prime Minister committed to us throughout COVID, through 36 meetings with premiers and the federal government, was that when we came through COVID, we would sit down and address the fundamental challenges that are facing our public health care system. They were masked through COVID because people were staying in place. Virtual engagement with healthcare providers was sufficient for Canadians to get through that extraordinary period. But now that we're through it, the cracks and the erosion of services are abundantly clear. The federal government harkens back to 1997 and says, well, we had a deal then, therefore we're finished. Well, we're an evolving nation. This is the essence of who we are as Canadians. When we come to places in our history where we need to sit down and reestablish where we're going together, we normally do that. The Prime Minister committed to all of us that we would sit down and engage in a discussion about the fundamental social program in Canada. We haven't been able to do that. So, back and forths about what number is correct, are tax points relevant as they were in the 90s today and as we look forward? Those are debates that we should be having together, not through the media. And that's why we're reinforcing today unanimity in our desire to have the federal government call a meeting. We'll arrive, could be in halfway or midway or whatever place the federal government wants to meet. We'll be there, and we can sit down and solve these problems for Canadians, not for provinces and not for the federal government, but for Canadians.
Next question, go ahead.
Glenn McGregor, CTV News. Premier Horgan, we haven't heard a lot here in Victoria about national pharmacare. And I'm just wondering if can the premiers continue to negotiate with the federal government on implementing pharmacare when the CHT issue is still outstanding, or is there a linkage? Can you get to one without the other?
I don't think you can get to one without the other, and that's why we've been very clear with the federal government that we're happy to talk about renewed programs like pharmacare or new programs like dental care, but we shouldn't be doing that until we have a firm foundation for our entire program, which is delivered by provinces, has been and will always be delivered by us. Those services are critical to citizens right across the land, whether you're in Lac Saint Jean or in Pouce Coupe. It doesn't matter where you live. Those services should be available to you on a national basis, and we want to make sure that foundation is strong. That means more resources, so that long-term resources, not one-time resources, so that we can plan and build out human resource strategies, so that we can look at improving our acute care outcomes. It's not about being unaccountable. It's not about coming with our begging bowl and saying, please, sir, give us some more. It's responding to the needs of Canadians. And those Canadians that are watching right now or will be reading about this throughout the week are scratching their heads saying, why in the world would our leaders not want to sit down and solve the problem that's so apparently obvious to us? The clients, the patients, the people who are demanding the services. We're supposed to deliver them. We are asking our federal partners to join us in something more remotely resembling a 50-50 partnership. I think that's reasonable. Certainly it's reasonable to say, let's talk about it.
Next question, go ahead.
It's Chris Rishowie from the Toronto Star. Ottawa said it won't turn over any more funding without some kind of accountability measures. The money won't be coming without strings attached. Is that something you can get agreement on amongst the premiers, and are there any measures that you think you could get them to bend on?
Well, it's difficult to, and I'll ask François to answer some of this question as well. It's difficult to make comments about accountability when we're accountable every day in our legislatures. We're accountable through our budgeting processes. Certainly in British Columbia, I can say without any doubt, every dollar that is expended is debated in our legislature, so there is accountability in that sense. There's also, of course, the requirement that we meet national standards in a range of areas. So I think that we're creating, or I would argue the federal government is creating a problem that doesn't really exist. We're always accountable to the citizens who vote for us in our jurisdictions, and we're accountable as a nation through confederation to ensure that our fiscal federalism processes are well understood and easily debated, and that the so-called strings make it sound like there's some sort of a serf relationship here. We are governors. We are equal orders of government. There's not a hierarchy here. We are the same, and we're saying we need to sit down collectively and figure out where we go from here.
Okay. Next question, please go ahead.
Véronique Prince, Radio-Canada. J'aimerais poser une question en français à M. Legault. Est-ce que le contexte électoral ne nuit pas, en quelque part, aux négociations? Parce que vous avez eu le gouvernement fédéral qui est en élection, ensuite l'Ontario, le Québec s'en va en élection, les deux provinces les plus populeuses. Est-ce que ça ne ralentit pas, finalement, la négociation? Bien,
écoutez, on a la même demande depuis 3 ans. Et comme le disait John, on a eu 36 rencontres téléphoniques avec M. Trudeau. C'était moi qui étais le président de la COF et à chaque fois, j'ai commencé mon intervention en disant la priorité pour les 13 provinces et territoires, c'est d'augmenter les transferts fédéraux en santé de 22 à 35 Donc là, on peut bien dire qu'il y a une élection, une autre élection. Ça fait 3 ans qu'on a la même demande, puis on n'arrive même pas à avoir une rencontre avec M. Trudeau.
Go ahead, Rob.
Good morning. Rob Buffum with CTV News, Vancouver Island. Premier, there's a protest planned for this morning at about 10 o'clock with people who are upset they don't have their own family doctor. As you know, there's close to 1 million British Columbians who do not. What do you say to those folks out front of the Empress this morning who feel like action's needed before we hear if money is coming? We don't know if there's even a meeting, as you've said, and the federal government's dragging their feet. And second of all, what do you say to those folks who are concerned that the province is spending money on urgent primary care centers at the expense of focusing on longitudinal care and family doctors?
Well, the healthcare system is not component parts, it's a holistic system going from primary care to acute care to long-term care and everything in between. And we as providers of those services are always trying to balance the needs of patients and communities, and we're all doing our level best from coast to coast to coast. Why we're having a discussion about funding arrangements is because we need to have a steady flow of revenues to build out the human resource strategies we're going to need to fill vacancies, to build up our post-secondary institutions so we're training more doctors, more nurses, more nurse practitioners. What I say to those who are assembling outside, good, because it appears that the federal government thinks everything's fine. Well, we know in provincial capitals across the country that's not the case. The issues that are emerging in British Columbia are also emerging in Ontario, in Quebec, in Prince Edward Island, in Newfoundland, and right across the board. So this is not a situation confined to BC. There are millions and millions of Canadians that don't have access to a family doctor. And the urgent primary care centres that we're developing are a gap, a stopgap in the process, so that we can build that out, takes pressure off our acute care system while we find a way forward with Doctors of BC and others to make sure we find the right balance between a fee-for-service system, which many doctors support, and a salary process, which many doctors support. There's not unanimity within the profession, therefore we have to sit down and work these things out, and we're doing that, as we should. What we're saying to the federal government is, why don't you emulate that behavior? We have a problem, we all know there's a problem. Instead of saying, oh, you've got enough, do what you can, sit down with us and figure out where we go from here. We all need to be accountable, not just provinces.
We have time for a couple more questions. Go ahead, please.
Bonjour, Nicolas Lachance, Journal de Québec, Journal de Montréal. Monsieur Legault, est-ce qu'un échec des négociations avec Ottawa pourrait mettre en péril la refondation du système de santé du ministre Dubé?
Bien, écoutez, actuellement, le Québec a posé les gestes qui sont nécessaires pour refonder le système de santé. On est capable de le financer. Évidemment, il y a un déficit à Québec. On a, à long terme, un vrai problème. Puis ce n'est pas seulement le Québec. Toutes les provinces ne sont pas capables d'assumer 78 des dépenses de santé qui augmentent de 5 à 6 par année à cause des impacts du vieillissement et des nouvelles technologies. Le problème qu'on a, c'est que M. Trudeau nous a donné de l'argent non récurrent. On a utilisé une partie de cet argent-là pour payer, entre autres, embaucher des infirmières. Mais là, si on veut être capable, à long terme, de continuer à payer ces infirmières-là, on a besoin d'un partenaire à plus que 22 On demande 35 c'est très raisonnable. Puis pour ce qui est du choix des priorités, bien moi, je fais plus confiance à Christian Dubé qu'à Justin Trudeau pour choisir les priorités en santé au Québec.
Next question will be our last question. Go ahead, please.
Bonjour, messieurs. Michel Sabat de la presse canadienne. Donc, je vais poser d'abord ma question en français, but I'll also need an answer in English for my colleagues at CP, Canadian Press. Donc, quelle garantie offrez-vous de ne pas réduire vos dépenses en santé ou de couper les impôts après avoir reçu du financement fédéral? In English, what warranties are you offering that you won't reduce your expenses, health expenses, or cut the taxes after received some federal money?
OK. Bien, d'abord, regardez combien les provinces dépensent, incluant le Québec en santé. Regardez le déficit. Regardez ce qu'on s'engage à faire dans le plan en santé de Christian Dubé. C'est clair qu'on doit dépenser de plus en plus en santé. Il y a un vieillissement de la population qui fait que la croissance des dépenses est supérieure à la croissance des revenus. Donc, c'est important d'être capable d'avoir cet argent-là. Il y a une partie qui est déjà investie, mais il y a une partie qui doit être investie dans les prochaines années. Mais c'est important, puis c'est clair qu'actuellement, le problème principal, le problème financier principal des provinces, c'est le financement des soins de santé, parce que le gouvernement fédéral finance seulement 22 d'une dépense qui croît à un rythme exceptionnel.
We set our budgets province by province by province, territory by territory by territory. We work on trying to balance the needs for education, for transportation, for healthcare services, and a range of other programs that provinces deliver. Again, I think it's a cop-out, and it's a mechanism to divert attention for the federal government to say, well, we don't want to continue to fund healthcare because you might do something else with the money. It all goes into a pot, and it all comes out for the services that Canadians need. That's our jurisdiction. That's what we are required to do, and that's what we do happily. What we're talking about now is not asking the federal government to monitor our budgeting processes. We're not saying we don't want to be accountable for the expenditures we make. We're saying to Ottawa, the system isn't working. It's a national system. And if you don't want to have a balkanization of Canada where Quebec chooses the course that they will take, BC chooses another course, and leaving smaller provinces to fend for themselves, we need a national strategy. This is federalism. This is who we are. This has been a grand experiment for over 150 years, and every now and again we have to pause and say to each other, from coast to coast to coast, where are we going from here? That's reasonable, that's ordinary, it's not extraordinary, it's what we are as Canadians. And this experiment has worked so well because historically we have come together in times of crisis, as we did through COVID-19. And I applaud the federal government for all of the effort they put into ensuring that we all collaborated to make sure Canadians were safe and that we got through COVID with the least amount of impact on humans and families and communities. Now we're out, we're on our way to a different future that is uncertain. Canadians want to know that their leaders are going to sit down and figure out where we're going together. That's what this is all about. It's not about we want something without accountability. We want to sit down and reimagine Canadian healthcare in 2022. Let's get on with that. That's the message to Ottawa. If they want to go on a talk show and complain about us, that's fine, but no one will thank them for that. I certainly won't, and nor will Canadians.
Thank you, everyone. We'll be back at 2:30 this afternoon.